been a long time since we started this show talking about COVID-19, but vaccines are back in the news today. Specifically, a panel of experts at the CDC voting unanimously to add the COVID vaccine to its list of recommended immunizations. Now, there is a lot of misinformation on this topic out there, so we want to start here at 5:30 with the facts. So the CDC does not determine which vaccines are required to attend school. That is up to each individual state. Here in New York, required vaccines are actually written into statute. Public Health Law Section 2164 currently requires all of those vaccines that you see on your screen in order to attend public or private school. It includes tetanus, measles, mumps and rubella, polio, etc. There are medical exemptions for these vaccine requirements. You'll notice that HPV and flu are not on that list, even though they are recommended by the CDC. Now, to change this list, you would actually need a law to be passed by the state Senate and Assembly and signed by the governor. Joining us live right now to talk about all of this is Dr. Thomas Russo, Chief of Infectious Diseases at UB's Medical School. Dr. Russo, it's nice to have you back on. Just to be clear here, this change today by the CDC, and if the CDC director accepts it, is not going to impact what vaccines are required for kids to attend school here in New York. But it is designed to inform doctors like yourself, especially pediatricians, as they talk to parents about what they should do for their kids. So what practical impact do you see this having, and do you agree with the decision from the panel?
Michael, I do agree with this decision. And essentially what it does is it signals that first, COVID is here to stay. We're going to have to deal with it. And secondly, and most importantly, it, like all the other vaccines in the list, supports that the benefits of COVID vaccination far, far outweigh any potential risks.
I want to dig more into that in just a moment. But first, each state gets to decide, again, which vaccines are required. The CDC does not have the power to mandate vaccines in schools. But we are having that debate here in New York State now, considering the vast majority of parents have not gotten their kids vaccinated against COVID. I wonder if you think it will be a mistake if New York were to try to mandate this right now. We know that Florida, for instance, has said it absolutely will not mandate the COVID vaccine. It will be a state-by-state decision. But considering some of the hesitancy out there and just how short a period of time this vaccine has been available, do you think it will be a mistake to mandate it at this point?
From a public health and an infectious diseases point of view, COVID vaccination and its benefits are quite clear. They're obviously beneficial. However, this in this country has been an extraordinarily emotionally charged topic, particularly when it comes to vaccinating our children. So I think we're going to need a little bit more time to process the consideration on whether we should mandate or not mandate COVID vaccination for our school children.
Yeah, it's one thing for you as a medical professional to come on and advise parents that they should do it. It's another to actually say, you have to do this or your kid can't come to school. I want to ask you about a tweet that is getting a lot of attention right now and was put out kind of in light of this CDC decision that this panel made. And we'll show it to our viewers right now. Megyn Kelly, who has a podcast and a satellite radio show, said, "A scary number of kids are dying after taking the COVID vaccine from myocarditis, among other injuries. How dare the CDC add this to its list of school vaccinations? Don't listen. Be very careful with your teenage boys in particular, but girls too. These are not honest brokers. This is dangerous." I'm apprehensive to put something like that on the screen without, also the word that says misinformation or a lot of this is false. But I wonder if you can fact check that here, Dr. Russo. Are there actually any myocarditis deaths connected to the vaccine?
I am not aware of any pediatric vaccine-related deaths from myocarditis or any other adverse reaction. In fact, the likelihood of you getting myocarditis is far greater from getting COVID itself than from vaccination. And I think it's important to point out that by contrast, although we haven't had any vaccine-related deaths in our children, there's been approximately 1,500 pediatric deaths since the beginning of this pandemic. And obviously, though not as many deaths as we've seen across the entire population, every pediatric death is quite tragic.
Before I move on to our final question, Dr. Russo, just to follow up for a moment there on myocarditis, though, it is something that can be serious and it is something that can be triggered by the vaccine, right? How is it that you balance whether or not it is beneficial for your child, especially if you have a teenage boy who seems to be most at risk of myocarditis from the vaccine? How do you balance that out?
The cases of myocarditis that have occurred after vaccination are fortunately uncommon, and they've been mild and they've resolved without any sequelae. If you want to minimize that risk of myocarditis, not all vaccines are created equal. The Pfizer vaccine has a lower incidence of myocarditis in that young male demographic that you just mentioned. And if you spread the shots out longer to as many as 8 weeks, you'll further decrease the likelihood of myocarditis. And in that manner, you'll get both the benefits of vaccination and minimize the likelihood of that particular adverse reaction.
Finally, Dr. Russo, before I run out of time, I want to ask you about sort of COVID in kids in more general terms. This past week, the American Academy of Pediatrics reported the fewest number of cases among kids since April. We're at about 28,000 new cases, kids representing about 13% of the total right now. We've long known that kids generally do better with COVID than adults. So what do you say to parents who just look at this and say, I don't want to risk it with these vaccines at this point because my kids are probably going to be fine?
Michael, unfortunately, winter is coming, and with it will be an unquestionable surge in cases in all age groups, including children. And we know, as we've discussed, that the benefits of vaccination far outweigh any potential risks. And so maybe just to quickly summarize what those benefits are for everyone, and in particular our children. First, if you're vaccinated, you're less likely to get infected, which means that you'll be able to stay in school. Secondly, you're less likely to get long COVID, which is an important and a problem that we're becoming increasingly aware of. Third, you're less likely to develop severe disease, become hospitalized, and have a bad outcome. We already mentioned those unfortunate pediatric deaths. And lastly, if you're vaccinated, you're less likely to transmit disease to others. And this is particularly important for children that will be interacting with others in their family, such as grandparents that are more vulnerable and greater risk for a bad outcome. You know, we have the tools in this country to really minimize the consequences of COVID, and we haven't fully taken advantage of them yet, in particular with our children. We just need to do better with this, Michael. If we could get more people protected, obviously the consequences and the burden of disease is going to be significantly less, and it'll benefit everyone.
Dr. Thomas Russo, Chief of Infectious Diseases at UB's Medical School. Thanks for coming on. We appreciate it.
My pleasure, Michael.